Yashoda Hospital. Good afternoon, everyone. I am Dr. Sarada Mamilla, consultant obstetrician and gynecologist, Yashoda Hospital. It's been long that we did not connect with each other. So this time we are back with an important discussion as to how to recover and how to prepare for a surgery. Surgery is a part, maybe in many of our lives, we come across this phase of surgery, and maybe in us, in our relatives, or in a very close family members. And most of times, we have a lot of myths around this preparation for surgery. So, be it what diet to eat, what not to eat, bed rest, so many myths around surgery, recovering from surgery, and preparing for surgery. So, today, let us clear some of the myths. I know even after this small talk, there are a lot of doubts amongst you, but the small common things which most of the patients do ask us, let's try to talk about. So first thing is, how do you prepare for a surgery? So for a scheduled surgery, the day you'll be asked to not to eat some food. So, at least 6 hours before the surgery, you are advised not to eat food. So 6 hours is enough, and if you're taking some liquids, 4 hours is enough. So gone are the days when people used to fast for at least a day before surgery. So you can take your food the night before surgery. You can have your proper meal. In the morning, when you get up and go for your surgery, take a proper bath. So and you can take your medication. So some of them do have hypertension. You are on a continuous hypertensive medication, some thyroid disorders. So that when you have an anesthesia checkup before surgery, the doctor advises you to take some medication. So please do take those medicines with small sips of water, and you can come for the surgery. The other thing is you take a proper bath. So cleanliness is very important to prevent you from infections. And cleaning the hair around the incision site of the surgery. So initially, people used to shave off all the hair, but nowadays we only trim the hair around the incision side of the surgery. And once the surgery is done, so after your surgery, so you can be either under a spinal anesthesia, which is just your lower half of the body is anesthetized, or a general anesthesia where you don't remember anything. You go to sleep and you wake up after your surgery. So any of these anesthesia and you're recovering from surgery, immediate after the surgery, when you are in a preoperative area, you will, when you are under general anesthesia, your brain might not be so alert. It might be a bit wavering. So don't panic. That's a very normal thing. Similarly, for spinal anesthesia, your legs won't move. So that doesn't mean that they are like that. You'll take time to recover. Say for 4 hours to recover. And if it's general anesthesia, you might take some time for the brain to be more clear. Yeah. So, and then you might feel some pain. So for the pain, you can take painkillers. It's nothing wrong to take some painkillers after surgery. And you need to move. So movement is a very important part. As soon as you feel your limbs, as soon as you feel your feet, try and move your feet. Try and move your legs. Turn from one side to another side of the bed. So there is a lot of myth that after surgery you should lay still. You should not move. So many of them to come and tell, if you ask them to move, they say if they turn around, the stitches will burst away. That is a myth. So once you turn, once you ambulate, ambulation is moving, then the blood flows through your legs, lower legs, or flows through your limbs and gives you a sense of well-being. So that is your first step to recovery. And then your bowel inside your stomach starts moving. That means the bowel starts moving. Even that is an important step towards recovery. Otherwise, the bowel doesn't move. Your stomach is filled with gas, and you get a lot of discomfort on the first day of the surgery. So immediate ambulation after surgery is very important. And once you are up and about, when you have after 6 hours, you can move out of your bed. So that is the time when the anesthesia is totally weaned off. You can definitely move out of your bed. But if you have, and most of times after the surgery, you'll have a tube for urine to drain out. So we can remove that tube 6 hours after surgery if you're confident enough to move out. And after the surgery, when you're recovering and you're advised to eat, so when to start eating after surgery. So many a times, 4 to 6 hours after surgery, we can start your food. So at least start with liquids and then move on to your solid diet. So sometimes some of them might have vomiting. So that might be because of general anesthesia, a side effect of general anesthesia. Don't panic. That is a normal situation. But if you're vomiting continuously, a lot of green liquid is coming out, then we have to check why you are vomiting so much. And you can take some medications for the vomitings. Similarly, after surgery, the bowel passes down. So you feel that gas coming down. That means the bowel has started moving and you can have your food normally. And so you can get up out of the bed 6 hours after surgery, go for a small walk on the first day of, so that gives us a confidence that you are getting better. And once you are, you can usually we are planning a discharge on your third day of the surgery, or once you are off all your IV medications. And after going home, try and take some rest. So surgery is a healing phase. So when the tissues do heal, if you are taking good rest, so that rest doesn't mean that you are on the bed all the time. So rest means that you are eating food at a prescribed time and you're not doing your extra activities. You can do your day-to-day activities, but the extra strenuous going to work and all, you take rest at home. And you can take bath every day, even though you have a surgical incision site. Take bath, let the water fall on the incision, and wipe it dry after your bath. Most of the people do cover that incision. They don't want water to go inside. That is a big myth. But when the water and soap with soap water, you wash off the wound, you are washing off all the infection around the wound. So you need to wash off all the dirt around the wound and wipe it dry. You can take bath every day based on your weakness or your strength and capabilities after surgery. You can definitely take a bath, and you can walk about a bit, and you can eat all the food. There's no food restriction. So as I already told you, surgery is a healing phase. That means lot of collagen is depositing, tissues are healing, protein is developing. So you need lot of protein food. There's a big myth not to eat lot of pulses. Many of them say we have to avoid chana dal, we have to avoid besan, all these things, but they are all good proteins. So protein helps in tissue healing, tissue formation and all. So there's no evidence that eating those foods will give the pus formation. So when the proper cleanliness techniques, sterilization techniques are followed, and you are given a proper dose of antibiotic, the infection rates are very, very less. By eating those things, you are avoiding the protein and not allowing the tissues to heal. So you are advised to eat a good protein diet. Maybe your stomach might be a bit delicate because of the antibiotics and the iron supplements, but you can eat all the protein food, all the both animal and plant-based proteins, a lot of liquids. So proper diet, adequate rest will definitely heal you back to your normal life. So when do you go back to your normal life? The first week, a lot of rest. The second week, maybe all that weakness of surgery is gone. The weakness of surgery is gone, and you can be ambulating a bit. Try and go for a walk. So slowly you decrease your rest, come back to your activities. So proper exercise, so small walks, you are just strolling for it so that your digestion improves, your tissues do heal well. The second week and third week, and by fourth week you are almost back to normal. You can start exercising as you were before, at least if not the strenuous abdominals and all, the proper walk, and you can drive after 4 weeks, drive a vehicle after 4 weeks, and go back to your work after 4 weeks. Thank you.
Last week of June.